Access to Innovative Therapies and Optimizing Care. And I'm here on behalf of all the co-leads, Norm Cook, Jeffrey Clovillier, Paul Gibson, Lisa Goodyear, Vijay Ramaswamy, Hope Russell, and Patrick Sullivan. So some of the core themes that we had identified in this within our grand theme was to improve patient navigation. There's a lot to what that means for different people and for different specialties, and really to get a sense of what the patient navigation scene across the country looks like for both a patient and a healthcare provider side. We identified that access to novel, quote, innovative therapies, including CAR T cells, jiving with the previous presentation, MIBG and proton therapies as example, is important. And to do that, we have to continue to advance abilities of patients to access these treatments, as well as the research backing the evidence behind it. And then we also identified a priority as increasing the ability of getting patients or children to clinical trials and clinical trials to children. So our group has some projects in progress, as well as projects in active planning, and I've listed them here. One of the projects that is underway is allowing Canadian sites to join an international registry called the Pediatric Proton Photon Consortium Registry. And this was started out of Boston and is now expanded to mainly North American sites and one Australian site. And the former CPCC, now ACCESS, has funded this study to open at 6 Canadian cancer centers as an initial start. Toronto has put on 52 patients and gotten updates from BC, Edmonton, and Calgary that efforts are ongoing there. And Montreal McGill, sorry, is actively interested, as well as exploring with Halifax. On the right side of the slide, there's efforts in our group to do an environmental scan of what patient navigation looks like. And then once we have that, we can see where the gaps could be and find ways to improve that for both patients and healthcare providers. And then Dr. Goodyear is looking at improving access to these trial navigators across Canada. Dr. Gibson within our group is looking at ways to reduce regulatory barriers to accessing innovative therapies across Canada. There's lots of those, as we all know, and is there a way to knock some of those down? And then there's an overarching theme as well, working with groups like ULink to find ways to get families to innovative therapies, families to clinical trials that may not be at their home institution. So that's some of what we've been up to. If there's any interest, please contact the ACCESS Secretariat, and we're happy to get in touch. Thank you.